Emotional intelligence or emotional quotient plays a huge role in patient counseling. This important skill separates a good pharmacist from a truly impactful one. So, in this video, we're going to talk about how important is EQ in patient counseling. Welcome back to my YouTube channel and let's get started. Let's talk about how each component of EQ helps in improving your patient counseling. Number one, self awareness. Understanding your own emotions before helping others. So we all know that in pharmacy it is everything is rushed, everything is multitask. Sometimes you even feel irritated after long hours of shift. Very important to recognize that you're feeling rushed, you're annoyed, you're distracted, and these things should prevent the way how you speak with the patients. So you have to ensure your tone, your body language should be calm and composed and patient centered. So basically, you're realizing that you're so tired from a long shift, you're irritated, but you realize these emotions and you consciously slow down and reset your tone before starting a counseling session or before serving a patient. Next is self regulation. So, staying composed and professional in any situation is very important. So, it's very essential when you're dealing with difficult patients who are angry, who are having chronic illness, who are like when you talk about cost of medications or side effects. This way of self-regulation, it will help you to respond with patience rather than becoming irritated and defensive. For example, a patient blames you for a prescription error. Instead of reacting, just listen calmly, just take a pause, take a breath, clarify and guide them to a proper solution. Next is empathy. Empathy is like understanding and valuing your patient's feelings. For example, this is a very important key in building that rapport, that trust, especially with elderly patients, anxious patients, patients who are newly diagnosed with a disease. Empathy makes patients feel heard, not rushed. So, for example, you notice a patient is nervous about using an inhaler, or they are like scared that they will be dependent upon this inhaler. So instead of just explaining like how to use and all that, you can use some words like, yeah, I understand this might be difficult for you initially, but I will help you how to use this. I will explain step by step, and this is just for these many days, and depending upon your condition you might not need it for a long term. So use some words which will help them to be calm, and like if it is regarding devices like using insulin, bring that confidence in them on how to use it properly, guide them. So in this way, being empathic is very important in patient counseling. Next is motivation. Motivation is like having a genuine drive or passion to help a patient. So this is not just to get them through the queue. This is something which encourages you to go an extra mile. So, example, you're following up on a side effect, you're following up on the patient, providing them printed information suggesting lifestyle. So, all this kind of extra effort which we are putting into the patient, they will sense your care and they're more likely to follow your advice. Next is social skills. So, this is really needed for effective communication and building patient relationships. This social skills will help you to adjust your style of patient counseling, because the way how you speak with elders is not going to be same as the way you speak with a teenager. So, effectively communicating to the patient, this builds confidence in them, so that patients should feel that you're approachable. They might also share their concerns and ask questions. So, for example, using a simple language or open-ended questions can help them to open up, or help them to ask questions about anything. Knowing a language is a plus point, but sometimes we don't know all the languages, because I still remember I had encountered a patient who speaks Spanish. He doesn't speak any one word, like not even one word of English. I used Google Translator. I didn't stay there to call a translator and bring that person there. I used a Google Translator. So this way, use these applications for patient counseling. This is the time where these applications are really useful. Having a high EQ or improving your EQ will help you to provide more effective, personalized, and trusted patient counseling services. In long term, this will build that pharmacist-patient relationship, and this can lead to better outcomes. So I hope this video was informative for everyone. If you found this video interesting or informative, share it with your friends. Thanks for watching. Don't forget to subscribe my channel and support this pharmacist community. Thanks for watching. Have a nice day ahead.